New data from the state health department, a pretty notable jump in COVID cases. More than 9,700 cases recorded Monday and Tuesday, so nearly 5,000 a day. That is well beyond recent pace. Our testing positivity rate is also higher, coming in at 14.6% yesterday. Several health departments in West Michigan received their first batches of Pfizer's Pediatric COVID-19 vaccine. Officials in Kent County say they received 2,400 doses today and are working to hand them out to local pediatricians. They will also start giving out shots at their clinics starting on Friday. This is a big step in our fight against COVID-19. Joining us to talk about it, Marcia Mansoray, the Deputy Health Officer for the Ottawa County Department of Health. Thanks so much for being here tonight.
I'm glad to be here. Thank you.
Obviously, a lot of parents really breathing a sigh of relief with this new option. So this could be a real step toward ending the pandemic finally.
Absolutely. And, I'm grateful and breathing a sigh of relief myself.
So we've been focused on herd immunity. The magic number floated around about 70%. So what does vaccinating kids do to push toward that?
Well, the more we've learned about COVID, especially in this Delta era of the COVID-19 pandemic, that 70% is probably far short of where we need to be, probably more like 85% or higher. So vaccinating everyone possible is going to be very important. And ages 5 to 11 is a big piece of that. And so it's going to help our whole community, but particularly as these kids gather in school every day, which they have to do for an education, and they're in relatively close quarters, 5 days a week, hours and hours a day, it's really important to protect them.
What's your message to parents at home who are apprehensive about getting this vaccine for their child?
Well, I can tell them as a public health professional, a mom and a grandma, that I haven't hesitated to vaccinate my own children, and I've recommended that my 5-year-old grandchild get vaccinated. This whole vaccine has been so carefully rolled out, and vaccines are held to a much higher standard than medications because they're given to people who are well to keep them well, not to people who are ill who need to recover from something serious. So we want people to be well and healthy. COVID-19 is such a difficult virus, and it does cause really severe outcomes. Those are much less likely to happen in children who are 5 to 11, but they still do happen, and we are seeing rather alarming increases continuing in cases, and we are seeing hospitalizations of children in our own community and in our region. And that's a really good reason. Statistically, you may be able to say of all children, just this little tiny percentage of them have these severe outcomes or death. There's almost 800 kids who have died from COVID in the U.S., but I only have 1 or 2 kids, so I can't afford to lose 1 or 2 of my children or have them harmed for life or even for months. So this is safe, it's effective, it's been given to millions and millions of people around the world. I feel very confident in it and would much rather give my child a vaccine than have them risk COVID-19 illness.
Great information. Marcia, thanks so much. Good to see you.
Thank you.